If you are over 60, I need you to stop whatever you are doing right now and watch this video until the end. Because what I am about to share with you could literally save your life. Every single day, I see patients who come into my office, and they tell me the same thing. Dr. Carter, I had no idea. I felt fine. And that is exactly what worries me the most. The heart does not always send loud warnings. Sometimes, it whispers. And if you don't know what to listen for, you might miss it completely. So today, I want to talk to you. Not as a doctor reading from a chart, but as someone who genuinely cares about you living a long, healthy life. Stay with me. This is important. My name is Dr. William Carter. I have been a practicing cardiologist for over 25 years. In that time, I have sat across from thousands of patients. Men and women just like you. People who were active, who felt healthy, who never imagined they had a heart problem. And yet, many of them did. The truth is, cardiovascular disease is still the #1 cause of death in the United States. And after the age of 60, your risk increases significantly. But here is what I always tell my patients, and what I want you to hear clearly today. It is not too late. Not even close. The habits you build today, the awareness you carry with you, the small decisions you make every morning, they matter more than you think. So let's talk. Let me walk you through what I wish more people knew before it became an emergency. The first thing I want to talk about is something I call the silent enemy. High blood pressure. Or as we call it in medicine, hypertension. Now, I know you have probably heard that word before. But I want you to truly understand what it means for your body after 60. When your blood pressure is too high, your heart is working harder than it should. Every single beat. Every single minute of every single day. Imagine carrying a heavy backpack everywhere you go. Up the stairs. To the grocery store. To bed at night. Your heart never gets to put that backpack down. And the most dangerous part? Most people feel nothing. No headaches. No dizziness. No warning signs at all. I've had patients come in for a routine checkup, feeling completely fine, and their blood pressure was dangerously high. They had no idea. This is something I always tell my patients, knowing your numbers is not optional after 60. It is essential. Now, what can you do? First, get a simple blood pressure monitor for your home. They are inexpensive, easy to use, and they give you information that could genuinely save your life. Check your pressure in the morning, before you eat or drink coffee. Sit quietly for 5 minutes first. Then measure. Write it down. A healthy reading is around 120/80. If you are consistently seeing numbers higher than 130/80, please talk to your doctor. And here is a small habit that many people overlook: reduce your sodium intake. I am not saying you can never enjoy your food. But sodium, it holds water in your body, and that extra fluid puts more pressure on your arteries and your heart. Try cooking with herbs and lemon instead of salt. It is a small change. But over weeks and months, it makes a real difference. Now, something very important I want you to understand is, heart attacks do not always look like what you see in the movies. In films, someone grabs their chest dramatically and falls to the floor. And yes, that can happen. But more often, the signs are subtle. Quiet. Easy to dismiss. I have seen patients who thought they had indigestion, and it was a heart attack. I have seen patients who felt unusually tired for a few days and chalked it up to aging, and it was a heart attack. I have seen women, in particular, experience nausea, jaw pain, or back discomfort, with no chest pain at all, and it was a heart attack. You are not alone if you have ever brushed off a symptom because you thought it was nothing. Almost everyone does. But here is what I need you to remember. If you ever feel any of these things, pay attention. A pressure, squeezing, or heaviness in your chest, even if it comes and goes. Shortness of breath that seems unusual. Pain or discomfort that spreads to your arm, jaw, neck, or back. Feeling dizzy, lightheaded, or suddenly very cold and sweaty. An overwhelming sense of fatigue that does not match what you have been doing. Any one of these things, especially if they appear together, do not wait. Do not drive yourself. Call 911 immediately. Time is everything with a heart attack. Every minute matters. And asking for help is never an overreaction. Never. Another thing I often see in my patients after 60 is something called an irregular heartbeat. The medical term is atrial fibrillation, or AFib. But let's keep it simple. Your heart is supposed to beat in a steady, rhythmic pattern. Like a drum playing a consistent beat. With AFib, that drum loses its rhythm. It beats too fast, too slow, or in a chaotic, unpredictable way. And while that might sound alarming, the good news is, many people live healthy, full lives with AFib when it is properly managed. The problem is, many people do not even know they have it. Some patients describe it as a fluttering feeling in their chest. Like a fish flopping around inside. Others feel their heart racing out of nowhere, even when they are sitting still. Some feel nothing at all. Why does this matter so much? Because AFib significantly increases your risk of stroke. When the heart does not beat properly, blood can pool inside it and form clots. Those clots can travel to the brain. And that is when a stroke happens. One of my patients, a 67-year-old retired teacher, came in because she occasionally felt her heart skipping. She almost did not mention it because she thought it was just anxiety. We ran an EKG. She had AFib. We adjusted her care plan. And we very likely prevented a stroke. Please, if you feel anything unusual with your heartbeat, tell your doctor. It might be nothing. But it might be everything. Now, let me talk about something that is often misunderstood. Heart failure. When people hear those two words, they think it means the heart has stopped. But that is not what it means. Heart failure means the heart is still beating, but it is not pumping blood as efficiently as it should. It is working, but struggling. And the symptoms can creep up on you so gradually that you barely notice them at first. Do any of these sound familiar? Your ankles or feet have been swelling at the end of the day. You get out of breath doing things that used to be easy, like walking from the bedroom to the kitchen, or climbing one flight of stairs. You wake up at night feeling like you cannot catch your breath. You feel persistently tired, no matter how much rest you get. Now, I am not trying to alarm you. These things can have many causes. Not all of them are heart failure. But this is where I need you to listen carefully. Do not just accept these symptoms as normal aging. They are not. I have seen patients who spent months, sometimes years, telling themselves they were just getting older. By the time they came to see me, their heart had been struggling for a long time. The earlier we catch it, the more we can do. That is always true. If you are experiencing any combination of these symptoms, please schedule an appointment with your doctor soon. Not next month. Soon. Now here is where things become serious, and also where you have the most power to make a difference. Because beyond genetics, beyond age, your daily habits are the biggest factor in your heart health. And some habits that seem harmless are quietly damaging your heart every single day. Let me start with sitting. I know that might surprise you. But prolonged sitting for hours without moving, increases your risk of blood clots, raises your blood pressure, and slows your circulation. This is something I always tell my patients: you do not need to run a marathon. You just need to move. Set a gentle reminder on your phone. Every 45 minutes to an hour, stand up. Walk to the kitchen. Step outside for 2 minutes. Stretch your legs. It is that simple. Now let's talk about sleep. Poor sleep is one of the most underrated risk factors for heart disease. When you do not sleep enough, or when your sleep is fragmented and restless, your blood pressure rises. Inflammation increases. Your heart never truly gets to rest. If you are waking up multiple times a night, if you snore loudly, or if you wake up feeling as tired as when you went to bed, please mention this to your doctor. Sleep apnea, in particular, puts enormous strain on the heart and is very common after 60. And one more thing I want to address. Stress. Chronic stress raises cortisol levels. It increases blood pressure. It causes inflammation. It makes you more likely to make poor choices with food and activity. You are not alone if life feels heavy sometimes. Many of my patients carry enormous weight, worrying about their health, their families, their finances. But I want you to know, protecting your heart also means protecting your peace of mind. Simple things help. A short walk outside. Time with someone you love. Prayer, meditation, deep breathing, even 5 minutes of quiet can lower your blood pressure measurably. I want to spend a moment on food. Not to lecture you, because I am not a fan of making people feel guilty about eating. But there are a few things I see consistently in my patients who have the best heart health outcomes, and I want to share them with you. First, eat more vegetables and less processed food. I know, you have heard that before. But let me tell you why it matters specifically for your heart. Processed foods, packaged snacks, frozen meals, they are loaded with sodium, unhealthy fats, and additives that raise your blood pressure and promote inflammation in your arteries. Fresh vegetables, on the other hand, are full of potassium, which actually helps lower blood pressure naturally. Foods like spinach, sweet potatoes, avocados, and bananas are wonderful for your heart. Second, pay attention to your fats. Not all fats are bad. In fact, healthy fats from olive oil, walnuts, fatty fish like salmon, they actively protect your cardiovascular system. But trans fats and excessive saturated fats, found in fried foods and many baked goods, can clog your arteries over time. And third, stay hydrated. This one is so simple, and so overlooked. After 60, your sense of thirst decreases. You may not feel thirsty even when your body needs water. And when you are dehydrated, your blood thickens, your heart works harder, and your blood pressure can spike. Aim for at least 6 to 8 glasses of water a day. Not sugary drinks. Not excessive coffee. Water. Small changes in your kitchen can have a bigger impact on your heart than almost any medication. I want to pause here and speak to you very directly for a moment. Every week, I see cases that did not have to happen. Emergencies that could have been prevented. Patients who told me they noticed something was wrong weeks, even months, before they came in. But they waited. They did not want to bother anyone. They thought it would pass. They were afraid of what they might find out. I understand that fear. Truly, I do. But I need you to hear this, from one human being to another. Ignoring a warning sign does not make it go away. It only gives the problem more time to grow. A heart attack that is caught early, or better yet, prevented entirely, changes everything. It means more years. More time with the people you love. More mornings to wake up and feel grateful. But that only happens if you pay attention. If you speak up. If you take action. Please. Do not wait until it becomes an emergency to take your heart seriously. You have people who need you here. And you deserve to be here for them. Before I continue, if this video has been helpful to you, I want to ask you a small favor. Hit the like button right now. It helps this information reach other people over 60 who may need to hear exactly what you just heard. And if you have a friend or family member who should be watching this, please share it with them today. You might be doing something more important than you realize. And subscribe, so you do not miss the next video. I am here every week with honest, clear health advice for people who want to live better, longer. Now let me leave you with 5 simple habits that you can start today. Not tomorrow. Today. Gentle, encouraging voice. First, check your blood pressure regularly. Get a home monitor. Know your numbers. Make it part of your morning routine, just like brushing your teeth. Second, move your body every single day. You do not need a gym. A 20 to 30-minute walk, at whatever pace is comfortable for you, is one of the most powerful things you can do for your cardiovascular system. Third, cut back on salt and processed foods. Just one meal a day swapped for something fresh and simple can make a real difference over time. Fourth, prioritize your sleep. Create a calm nighttime routine. Avoid screens for an hour before bed. Keep your room cool and quiet. Your heart repairs itself while you sleep. Let it do its job. And fifth, and perhaps the most important of all, do not skip your doctor's appointments. I know life gets busy. I know it can feel unnecessary when you feel fine. But routine checkups catch things early. They give us the opportunity to prevent problems before they become crises. These 5 habits are not complicated. They do not require a lot of money or time. But done consistently, they could add years to your life. If you want to protect your heart before it's too late, check out the digital book now, 30-Day Blood Pressure Reset. Today you'll also receive 2 free digital books as a bonus. Link in the pinned comment and in the description. And one more thing before I go. I would love to hear from you in the comments below. Where are you watching from today? And did any part of this video surprise you, or remind you of something you have been putting off? Your comments mean a lot to me. And sometimes, reading what you share helps me decide what to talk about next. I want to close with something I say to every patient who walks out of my office. It is never too late to take care of your heart. Never. Whether you are 60, 70, or 80. Your heart is still working for you, every single second. It has never stopped. It has never given up on you. And now it is your turn to show up for it. Make the small changes. Ask the questions. See your doctor. Pay attention to your body. You are not just a number on a chart to me. You are a person with a life full of meaning. And you deserve every possible chance to live it fully. Thank you for watching. Take care of yourself. And I will see you in the next video.